alaikum rahmatullahi ta'ala wa barakatuh. Starts the development of cardiovascular system. The cardiovascular system is the first system to function during intrauterine life. It appears during the middle of the third week of development. It originates from the splanchnic mesoderm, paraxial and lateral plate mesoderm, and neural crest. Here, as we mentioned, the cardiovascular system develops from paraxial mesoderm, lateral plate mesoderm, and splanchnic mesoderm. Also originate from neural crest. Neural crest is a part of ectoderm. We have a cell called angioblast cell. This angioblast cell forms a strand known as angioblast cord. We have two angioblast cords. This angioblastic cord has a lumen and known as heart tubes. So there are two heart tubes. During the folding of the embryo, these two heart tubes merge together to form single heart tube. As we mentioned, their angioblast cell merge together or join each other to form angioblast cord. This angioblast cord has acquired lumen to form angioblast cord canal, and these canals fuse during the folding of the embryo to form single heart tube. This heart tube starts to elongate and bend on day 23, and this elongation and bending terminate on the day 28. The heart tube has two ends, cephalic end and caudal end. The cephalic end bend ventral, caudal, and to the right. So it bends anteriorly, inferiorly, and to the right, while the caudal end opposite to it, it bends dorsally, cranially, and to the left. As a result of the elongation and bending of the heart tube, now change its name from heart tube to cardiac lobe. The primitive heart formed after the cardiac lobe formed. This cardiac lobe acquired local dilatation and constriction and known as primitive heart. Now, first we have angioplastic cell join each other to form angioblast cord. This cord acquired lumen from heart tubes. This heart tube fuse together to form single heart tube. This single heart tube become elongated and bending to form cardiac loop, and this cardiac loop acquire local dilatation and constriction and known as primitive heart. This primitive heart have the following portion: sinus venosus, atrium, ventricle, again sinus venosus, atrium, bulbus cordus, conus cordus, truncus arteriosus. This is a part of primitive heart. What is the dextrocardia? Dextrocardia, the heart located on the right side. Here is a normal heart. And here is a dextrocardia, where the heart located on the right side of the thoracic cavity. As we mentioned, the primitive heart has different parts: sinus venosus, atria, ventricle, bulbus cordus, conus cordus, truncus arteriosus. It receives the blood through the sinus venosus. So, the sinus venosus receive the blood from right and left sinus horn. This is sinus venosus. The sinus venosus receives the blood from right horn and left horn. Each horn receives the blood from 3 veins, which are Fetal line vein, umbilical vein, and posterior cardinal vein. Fetal line vein carry poorly oxygenated blood from the yolk sac. Cardinal vein, which receives the blood from anterior and posterior cardinal vein. This cardinal vein receives the poorly oxygenated blood from the body of imperial umbilical vein, which carry the oxygenated blood from the placenta to the coronary sinus. Again, here is fetal line vein, carry poorly oxygenated blood from yolk sac. Cardinal vein, carry poorly oxygenated blood from the wall of the imperial. And umbilical vein, which carry oxygenated blood to the primitive heart. The left common cardinal vein, left fetal line vein, and the right umbilical vein disappear. The left horn, just a minute, as you see, the left fetal line vein, left common cardinal vein disappear. The left horn, this is the left horn, develop into coronary sinus. What happened to the right horn? The right horn and sinuses venosus incorporated in the wall of the right atrium to form the smooth posterior part. So, regarding the development of the right atrium has two main parts: rough anterior part and smooth posterior part. The rough anterior part develop from common atrium, while the smooth posterior part develop from right horn and sinuses venosus. Regarding the development of left atrium, the left atrium is smooth except the area of left auricle. So, the majority or the smooth wall of the left atrium develop from absorbed pulmonary veins, while the left auricle develop from common atria. Regarding the development of the right ventricle let's revise the gross anatomy of the heart of the ventricle. The ventricle has rough part and smooth part, or inflow part and outflow part. This inflow part is rough and the outflow part is smooth. Inflow part and outflow part according to the direction of the blood. So the rough part of the right ventricle develop from bulbous cordis, while the rough part of left ventricle develop from the primitive ventricle. The smooth part of the both ventricle develop from conus cordis. I will revise this point again. From the previous picture, here is primitive heart. Here the sinus venosus, which receives the blood from the right horn and left horn. The right horn and the sinus venosus form the smooth part of right ventricle. The atria develop into the rough part of the right and left atrium. The ventricle develop into left ventricle. Bulbous cordis develop into right ventricle. More specifically, the ventricle, the rough part of the left ventricle. Bulbous cordis, the rough part of the right ventricle. Conus cordis, the smooth part of the right and left ventricle. Truncus arteriosus will develop into root of bone monotrunk and ascending aorta. During the fourth week of development, the septa start to appear between the right and left atria. First, concentric fold appear from the roof of the atria, known as septum primum. So, what is the septum primum? Septum primum is a concentric fold developed from the roof of atria. It grows toward mesenchyma located here, known as endocardial cushion. Now, the opening between the ostium primum and endocardial cushion known as ostium primum. Before the ostium primum join the ostium endocardial cushion, perforation appear in the upper part of septum primum here, known as ostium secundum. A new precentric fold develop on the right side of the septum primum, known as septum secundum. The septum secundum grow distally. Now we have two septum, septum primum and septum secundum. Here is the septum primum and septum secundum. Perforation appear in the center of the septum primum. Now there is a gap between the septum primum and septum secundum, known as foramen ovale. So, what is a foramen ovale? Is a passage between the septum primum and septum secundum. This foramen ovale close immediately after the birth. And allow the passage of the blood between the right and left atrium during intrauterine drive. Okay. Atrial septum defect include common atria. Common atria means no partition form in between the right and left atria due to failure of development of septum primum and septum secundum. Other type of atrial septal defect include premature closure of the foramen ovale. That means the foramen ovale close during intrauterine life, which lead to enlargement or hypertrophy of the right side of the heart and underdevelopment of the left side of the heart. Why there is underdevelopment of the left side of the heart? Because the blood doesn't reach the left side of the heart. Here is the atrial septal defect or common atria due to failure of development of septum primum and septum secundum. Partition also form between the right ventricle and left ventricle. This partition has two parts, muscular part and membranous part. The medial wall of the right and left ventricle send septa to form the muscular part, while the endocardial cushion form the membranous part. So the interventricular septum, as you know from the gross anatomy, has two main parts, muscular part and membranous part. Muscular part develop from medial wall of the both ventricle, while the membranous part develop from endocardial cushion. Here is the medial wall of the both ventricle, which forms the muscular part, while the endocardial cushion forms the membranous part. VSD or ventricular septal defect involve most commonly the membranous part of the interventricular septum. Partition of the truncus arteriosus to separate the pulmonary trunk from aorta. It formed during the 5th week of development by two cushions. This cushion located on the right superior and left inferior wall of the truncus arteriosus. This cushion grow toward each other. When they approach each other, they follow a spiral course. This is the most important point. It follows a spiral course. If they didn't follow this spiral course, it leads to formation of transposition of the great vessels. Transposition of the great vessels means the aorta originates from the right side of the heart, so it carries deoxygenated blood to the tissue of the body, while the pulmonary artery carries oxygenated blood to the lung. Due to the conotruncal septum doesn't follow the spiral course. Another important malformation known as tetralogy of Fallot. Tetra means four. The tetralogy of Fallot had four components: hypertrophy of the right ventricle, overriding aorta, pulmonary stenosis, and VSD, ventricular septal defect. That regarding the development of the heart. Next presentation about the development of vascular system.